what time it is. Marvin Devine, Huber, Axel, and you know how we do. Yeah, I got the juice. Big game cool, make them look like cool. Always play it cool, that's the biggest rule. Fuck it, what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, Axel, and Huber, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go.
These brothers my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta roll with ice. Cold, these brothers my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta roll with ice. Ride or die, 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 ride or die. Cold, these brothers my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta ride or die.
Hello, everybody. Welcome, welcome, welcome. Tonight, we have two great nephrologists on to talk to us about kidney disease and scientific-based, plant-based kidney diet for kidney patients. One cooks, one does research. We've had Dr. Shusterman on before, the cooking doc. He returns to talk to us tonight. He is the president and physician partner at Carolina Nephrology, a 22 provider practice in Greenville, South Carolina. He is also the creator and host of the Cooking Doc. If you check in the notice to our broadcast, you'll find his links to his website and also links to purchase his book, The Kidney Doc's Kidney Healthy Cooking, a Modern 10-Day 10-Step Guide to Preventing and Managing Kidney Disease. He's a board-certified neurologist. He serves as medical director at multiple dialysis centers. He is a clinical assistant professor at USC School of Medicine in Greenville and oversees the medical student nephrology rotations. Very passionate about diet and management with kidney disease. The other doctor that we have on tonight is Dr. Shivam Joshi. Dr. Joshi is an internist, nephrologist, and plant-based physician practicing at NYC Health and Hospitals / Bellevue in New York City. He received his BS degree from Duke University, his MD from the University of Miami, completed his residency at Jackson Memorial Hospital, University of Miami, and his nephrology fellowship at the Hospital of the University of Pennsylvania. He is also the clinical assistant professor at the New York University School of Medicine with research interests in plant-based diets, fad diets, and nephrology. He has written numerous, and I do mean numerous, scientific articles and speaks nationally on these subjects. He is the youngest nephrologist to receive the NKF's Joel D. Koppel Award, the highest award in nutrition. So without any further ado, let's start the show, Steve. Oh, welcome, welcome, welcome. How's everybody this evening?
Great.
Hi, everybody, doing great.
Good.
Thanks for having us.
Oh, glad to have you. Glad to have you. Looking forward to our conversation. Did I state everybody's credentials and experiences correctly?
Yes.
Sounded good to me.
Okay. Let's start with Dr. Joshi first. In my experience, it's very unusual for a nephrologist to become an expert in nutrition. Please explain how and why you became interested in the area of nutrition for kidney patients.
Well, it started in fellowship. Actually, it might have started even before that. I've been an on and off vegetarian for many years. And in fellowship, I was asked to give a presentation, and I thought, why not combine these two subjects, plant-based diets and kidney disease? And then it's been go, go, go ever since. I think after that presentation, within a month, I was getting requested to speak on the subject, and I've just continued to go with it. And I really enjoy it clinically, because that's the number one question patients have is, what can I eat? What can I do to help my kidneys? And I think we as physicians don't do a good job answering that question. And I think there actually is a good amount in nephrology that we could speak on to answer that. And I think in many conversations we leave that off the table.
Okay, Dr. Shusterman?
Yeah, so mine didn't start quite as early as Dr. Joshi, but when I came down to practice in South Carolina, I noticed that there was really a lack of knowledge, both from the physicians and medical professionals down here and from the patients themselves, about the way food and what they eat can impact their kidney health and really make a tremendous difference in their overall progression of kidney disease and management of kidney disease. And so when I saw that there was a hole there, it really kind of drove me into that hole. And I thought that this was something that we needed to bring to the community and bring to the nephrology field, because as Dr. Joshi said, we don't talk about nutrition and kidney disease enough, or most doctors do not. And really, if we talk to people about it, it gives them empowerment and it gives them knowledge and a good way to help take control of their kidney disease in a lot of ways. And so you put that together with the fact that I love to eat and cook, and it became a passion of mine, and I've been going down that road ever since.
Okay. question for Dr. Joshi. Please explain what an evidence-based plant-based diet is and what science it's based on, because I noticed you write quite a bit on this subject.
Yeah, so I started with me trying to get these papers into journals, and now it's the other way around, where the journals are trying to get papers from me. But an evidence-based plant-based diet within the kidney disease literature would reflect a diet that emphasizes the consumption of foods that would help people improve their overall health, a diet that would help reduce the amount of medications they're taking, and help control the complications of the kidney disease that they have, and not to mention even attenuate the progression of their kidney disease. So when you look at the literature, and I've written a few papers on this, probably the biggest and best one, and the most recent one, is probably the one in American Journal of Kidney Disease that just came out. And we go through the literature and talk about what the evidence says. So when you look at the literature, granted, a lot of it's observational, meaning that it's not a randomized controlled trial, which is the highest level of evidence. But when you look at this observational literature, the people who tend to eat more red meat or meat tend to do worse in regards to their kidney functions. They tend to have a higher risk. For example, there was the Singapore Chinese health study. Those in the highest quartile of red meat intake had a 40% higher risk of developing kidney failure compared to those in the lowest. And this was in a dose-dependent fashion, meaning that the more red meat you ate, the higher the risk was of being associated with kidney failure. So there's a number of studies like this. So, and what we know is that plant-based foods have a whole host of benefits. They have natural alkali, so that people could potentially reduce the amount of sodium bicarb they're on. There's a series of studies, a series of trials, not just observational, showing the benefit of this, and people had lower blood pressures at the same time, and then they also had less proteinuria. So there's a lot of evidence supporting plant-based diets, and I could probably talk for the whole hour in regards to the benefits of it for patients with kidney disease. But for the sake of time, I'll be brief, and I'll let Blake jump in if he wanted to comment.
Go ahead, Dr. Shusterman.
Sure. Well, first of all, I'm grateful for Dr. Joshi, because I used some of his articles when I was writing my book, and the summaries of the trials were really fantastic and really put it all together. There it is. There's
thank you.
But the totality, or when you put all the evidence together, there's not a lot of randomized controlled trials, as Dr. Joshi said, but there's just a lot of observational data and a lot of signs that point to the fact that a diet that is focused around plant-based foods and away from things like red meats and ultra-processed foods can impact your health and your kidneys in a lot of different ways. And he mentioned from blood pressure to eating less animal protein to maybe a higher alkaline diet, which puts a little less stress on your kidneys. There's just a ton of different ways that a plant-based diet can help your kidneys. And I think, we're starting to see the evidence mount, and I'm really looking forward to the next 5 to 10 years to see if we get these randomized controlled trials that can really help us define exactly how a plant-based diet fits into the management of kidney disease.
Excellent. Excellent. Dr. Joshi, I've heard you speak about, and I've read about the use of evidence-based plant-based diet as useful in preventing kidney disease and kidney failure in some cases, and in particular, people that have diabetes and hypertension. Can you explain to us, please, how does that work? How does that help the patient control his health issues?
Yeah, so it probably would be helpful to put this in context of my own career trajectory. I initially wanted to be a transplant nephrologist, and my main research area interest was in actually developing these artificial kidneys. But through the course of my education, I actually realized that the number one cause of kidney failure is actually diabetes. Number two is high blood pressure. And then I thought to myself, well, that's just devastating because so many people have diabetes and high blood pressure. And then as I continue to progress, I realized that most of diabetes and most of high blood pressure is actually preventable with people eating healthier and exercising and losing weight. So the underlying cause for both of these diseases is lifestyle indiscretion, so to speak. And then so you might even say that because those diseases can cause kidney disease, that the underlying cause of kidney disease could also be not eating healthy or not exercising enough. We could talk about whose fault it is, but patient, society, the physician. But at the end of the day, we all have to work better to eating healthier collectively to help address these issues, and educating our patients and informing society and helping pass laws that subsidize fruits and vegetables so that it's cheaper for people to eat, and tackling food deserts and things like that. And I think Dr. Shusterman's book is a great way to start with that. I know we disagree on at the inclusion of animal protein, but when you compare it to the standard American diet, his book, and I've looked at it several times. I have his website pulled up here. It is miles ahead of the standard American diet, which is just chock full of fast food and unhealthy things, processed food, things that decades or centuries people would not even recognize as food. So you have homemade pico de gallo here. You have black bean quesadillas. You have a 7-layer dip. So many things that engage people to eat healthier, teaches them these skills that are very important that they can pass on to their family. It's a great resource, especially in the renal community where we don't have a lot of guidance or cookbooks like this. You go into cardiology, dime a dozen.
Okay. Dr. Blake, talk to us a little bit about plant-based diets, science, and prevention of kidney disease and kidney injury.
Well, I think Dr. Joshi hit the nail on the head in that the two top causes of kidney disease, diabetes and high blood pressure, can be prevented and managed with changes in diet. And so, when you look at dietary modifications that can impact your kidney health, if you stick to plants, meaning things like, and when we talk about a plant-based diet, there's a difference between kind of a plant-based diet, which is focused on whole grains, fruits, vegetables, cooking at home, beans, versus things like, macaroni and cheese or ultra processed kind of plant-based foods. Those are kind of, those may not be quite as good, but if you're focusing on a whole food plant-based diet, there are so many ways that it can help you manage your diabetes and help you manage your kidney disease, because the data is starting to show that it is effective. Now, the question of whether or not to include animal protein is a great question, and I think we'll know more in the future about how much animal protein is safe for people to prevent kidney disease from getting worse or to manage kidney disease. But a lot of the times down here in South Carolina, people have never gone a meal in their life without eating meat. And so kind of starting to meet people where they are and starting to cut out a little bit of meat at a time on the way to a plant-based diet is kind of a nice stepwise progression, and every little bit helps. Okay.
For both doctors, let's start with Dr. Joshi. I have read and heard you speak about plant-based diets being helpful to people that already have PKD. Can you talk to us, or CKD, my apologies. Can you talk to us a little bit about the benefits of a plant-based diet for someone that's already got chronic kidney disease? And if you could, is there a difference between dialysis patients and kidney transplant patients in terms of plant-based diet?
Yeah, so there's a little bit of difference there, and I know you didn't mean to say PKD, but had you did that, it actually would be a very hot topic right now in the back channels of the renal community, especially with ketones and the ketogenic diet. At any rate, to answer your question, so plant-based diets I think have a number of benefits for patients with kidney disease, and I've seen it in practice, and I think all nephrologists have seen the effects of dietary indiscretion in some way. I think if you think of plant-based diets as perhaps being potentially the best diet because it's very low in acid, it tends to be low in salt, has low amounts of bioavailable phosphorus, and it can also it helps avoid protein excess, which is important in those who have kidney disease. Excess protein has been shown in a number of studies and ultimately in a meta-analysis to cause hyperfiltration, and then can actually cause the kidneys to deteriorate ever so slightly faster. So I think for all these reasons, plant-based diets can be helpful for those with kidney disease, can help them reduce the amount of medications they're taking. It can also help slow down the progression of their kidney disease. The difference mostly for those on dialysis versus those who are not, so those who have CKD and those who are post-transplant compared to those who are on dialysis, is that dialysis patients need a little bit more protein due to the protein losses, the catabolic state, the inflammation. So that's the only thing to be wary of, but that's still attainable when you look at studies of patients eating plant-based diets on dialysis. They were able to attain the amount of protein that was required, and actually the most recent KDOQI guidelines actually revised the amount of protein necessary down to 1 gram per kilogram per day. So it's not as high as it used to be, which was 1.2 grams per kilogram per day.
Okay. Dr. Shusterman, in your opinion, is there a difference between CKD patients and diets for dialysis patients and kidney transplant patients? And if so, what do you see as a solution? A plant-based solution.
So the most important difference, I think, is that when you I kind of lump kidney transplant patients into the same category as pre-dialysis patients, because everybody who is not yet on dialysis, whether they have one kidney that's functioning from a kidney transplant or two kidneys that are just not functioning as well as they should, meaning you have stage 2, 3, 4 kidney disease, the goal at that point is to prevent you from going on dialysis. And so at that point, preventing you from going on dialysis can mean things like lower animal protein and lower protein in general, lower sodium foods, a higher alkaline-based diet. These are basically all kinds of things that will lessen the work that your kidneys have to do to process the food that you eat. And so if your kidneys are working less, and this is a very kind of simplified way of looking at it, if your kidneys don't have to work as hard, they won't go into this hyperfiltration stage, and you won't get scarring inside of the kidneys. And when you're doing all of that, you can prevent your kidneys from getting worse in some cases, or at least help them. Once you cross the point where you end up on dialysis, your goal is not necessarily to keep your kidneys filtering as well as they should to keep you off of dialysis, because you've already kind of crossed that bridge. At that point, the goal is to help manage what you take in so that toxins and waste products and fluid and salt don't build up between your dialysis sessions. And so while there are a lot of similarities in a plant-based diet between the two, and things like low sodium, and plants have less bioavailable phosphorus, so your phosphorus that you're eating is not getting absorbed as much. I think the difference is mainly in what the goals are for your plant-based eating, whether you're trying to keep your kidneys from getting worse so you don't have to go on dialysis, or whether or not you're trying to manage the waste products from the food that you eat so they don't build up too high, like the potassium and the urea and the phosphorus between dialysis sessions.
Excellent. Dr. Joshi, is there any downside or precautions to a plant-based diet that we should know about from your scientific studies and experience?
Yeah, I think the biggest one is potassium. So it's not necessary that people eating plant-based diets will develop high potassium levels. That's the big fear. That's actually the reason why, one of the reasons that we as a renal community have avoided recommending plant-based foods to our patients, because of potassium levels. The other big one is phosphorus, and then you could probably count protein as the third reason. But the phosphorus issue, I think, as Dr. Shusterman was saying, is that there's less bioavailable phosphorus. So even though these foods are high in phosphorus on the label or on the nutrition facts or wherever you go to get this information, once you account for bioavailability, phosphorus actually is very low. But what remains potentially as an issue is potassium, but not everyone eating plant-based diets develops hyperkalemia. And actually in the studies, very few, almost no one developed hyperkalemia. There's actually only one instance in all the studies that have looked at this, and that person had another explanation for having high potassium, and that person had a renal tubular acidosis. But there are actually factors that come with plant foods that can actually help balance this rise in potassium. So even though plant foods do have potassium, they also have fiber. So the more fiber you eat, the more bowel movements you have. And that, with each bowel movement, the bigger and more frequent the bowel movements you have, the more potassium you lose. So the potassium coming in theoretically could come out as well. There's emerging evidence to suggest that not all the potassium that is in plant foods is bioavailable, kind of similar to the phosphorus idea. That being said, there are some things that people should keep an eye on, and I've written about this as well. So juices, sauces, dried fruit, all of these things have the potential to be problematic if overdone, because they kind of take away some of these balancing effects. For example, with juice, no one sits down to eat 2 medium-sized oranges, but they may drink a glass of orange juice for breakfast, and that glass of orange juice, you're getting the juice of 2 medium-sized oranges and the potassium from those 2 medium-sized oranges. So when I tell patients, if you just eat the fruit itself, you're getting the fiber with it and you're not getting as much potassium. But when you start concentrating it in juice form, sauce form, you're eating more potassium per unit time, and that can lead you into trouble. Sauces are the same way. Dried fruit, even though you're getting the fiber, you're not getting that water content, and then you could end up eating more dried fruit than you had you eaten the whole plum, for example, if you were eating prunes in this example. Potassium supplements are a big problem, especially because we emphasize to our patients to avoid adding sodium. So they may add a salt substitute that inadvertently has potassium. That could be problematic. And then there's certain foods that are just extremely high in potassium that you'd have to be wary of, like molasses, which I think very few people would know about. Raw soybeans are high, but very few people are eating raw soybeans, and there's a couple other random things. But for the most part, if people are including more salads for their lunches, or more fruits for their breakfasts, or more tofu for dinner, I think these kind of changes have potential to benefit patients rather than harm them.
Dr. Shusterman, same question, pro and con scientific plant-based diet.
Yeah, I think that Dr. Joshi really hit everything as far as the possible downsides of the plant-based diet, and it's mainly this question of potassium more than anything. And I'm really interested to see more research come out about the effects of dietary potassium on your blood potassium level. You know, he mentioned some of the things that are really concentrated potassium that have the tendency maybe to shoot the blood potassium up. But for a lot of people, their potassium is not always dependent on the fact that they eat a tomato sandwich. Especially this time of year, everybody wants to have their summer tomatoes. And one thing people always ask, they always kind of Google the renal diet. And a lot of the information on the internet is kind of old and outdated, doesn't have a lot of these insights into plant-based eating that we're talking about today. And so they will immediately cut out, an avocado or some of these tomatoes that they're growing in their garden, missing out on some of life's greatest pleasures, like those fresh summer tomatoes. And so, I think that if we can get over the hump and figure out how much potassium you can eat to keep, and how much potassium affects your blood potassium level, that will really kind of be the last hurdle to kind of a full-on plant-based diet and understanding the risks and benefits with that. The only other things are it's sometimes difficult for somebody to go on a full plant-based diet, so incremental steps are important. Sometimes if you're on a plant-based diet, it takes a lot of time and energy to cook or to learn to cook that way, especially if you're used to using meats to flavor your food and meats as the center of your dish. Making that transition can be a difficult thing. So that's not really a downside. It's just more of a barrier to getting there.
Okay. Dr. Joshi, I want to ask you a question about your article, Plant-Based Diets for Kidney Disease, a guide for clinicians. And I wanted to point out to our audience, you write articles and make suggestions to other nephrologists. That's how important that your work is. Can you tell us what the guidelines for clinicians and other doctors were that you recommended for kidney patients like me?
Yeah, I think what the purpose of me writing is to help educate nephrologists, because we still tell not just nephrologists but everyone that treats and is involved in kidney disease and patients with kidney disease. So this includes nurses, nurse practitioners, PAs, social workers, everyone, because we've all been in a situation where the physician says something and then they meet with a dietitian and it's undone, or they or maybe it could be another patient. They say, well, you can't have a banana because that would skyrocket your potassium. I remember many times in my career, I would have someone that had diabetes and kidney disease, and they would just constantly get mixed messages. For diabetes, they were told not to eat white bread, but then for kidney disease, they're told to eat white bread, and then they're left confused, and they end up going to KFC because they don't know how to reconcile this, and it's very, very confusing. So the purpose of me writing is to clarify some of these things. Stop telling your patients to eat white bread. That doesn't do anyone any benefit. It's refined, it's processed. If you make a ham and cheese sandwich, you're not really improving upon what people are already doing. What we're trying to say is that some of the healthiest foods on the planet that have kept people alive for centuries, fruits, vegetables, whole grains, lentils, nuts, seeds, all these things are healthy, in fact, for patients with kidney disease. There are ways to do it wrong, definitely. We've seen it before. There's published reports of green smoothies causing oxalate nephropathy, people not getting enough protein, that one person with the hyperkalemia and the plant-based diet because he was eating raw edamame and he had RTA. So there are ways to do it wrong, but there are also ways to do it right, and we don't spend enough time teaching patients how to do that, just how to eat healthy, what are the ways to be healthy in general. And that's really the purpose of the writing. So the concrete recommendations that that we want to convey to people is that patients don't like taking medications. It's hard for them. It's there's co-pays involved. You have to get refills. You have to remember, especially phosphate binders. If we can make it easier for our patients to take fewer medications by telling them what to eat, how to eat healthier, I may do the what. Blake may do the how, and with the cookbook, and we could improve someone's life, and not just reduce some medications, but if we're also improving insulin sensitivity and blood pressure, we're also affecting nephron loss. We're also affecting that decline in GFR. So it's a multi-pronged approach at improving health, and that's really the big takeaway from the paper. Yeah, there's smaller nuances with alkali and phosphorus, blood pressure, and a couple of these other things, but the big takeaway is eating healthier in general for your body and your kidney.
Okay. Question for both of you. We'll start with Dr. Joshi, since he mentioned the keto diet. And Doc, if you want to say something about PKD, I'm a 41-year PKD patient, so I'm all ears. What is your professional opinion about the keto diet? Is it good or bad for kidney patients? What are the risks? What are the downfalls? Is there a scientific basis? What's the impact of a high protein diet on kidney health?
Yeah, so high protein diets, I recommend patients stay away from. Even if you're on dialysis, you only need, the latest guidelines say 1 to 1.2 grams per kilogram protein per day, assuming that you're in steady state and you don't have a wound or something else that would require you to have more protein. So I tell people to really stay away from the high protein diets. The ketogenic diet, despite a popular misconception, is not high protein, it's high fat. And the keto, the ardent keto supporters will correct me in a heartbeat on that. It's high in fat, it's moderate in protein, and scarce in carbs. To keep it brief, I don't particularly recommend the ketogenic diet for those with kidney disease. I think the literature is very slim. But when you look at the pediatric literature, there was a high prevalence of kidney stones, in excess of 20% of those on the diet. I think it has the potential to really increase the amount of acid load in people who are already struggling to balance the acid levels. And in some studies, there's some observations showing that high-fat diets, particularly saturated fat diets, can increase albuminuria. But the other side effects, like raising cholesterol and long-term health, I think are problematic. However, now there's this issue with PKD and the benefits of that. And what's interesting, as far as I understand, is that you can derive the same benefits from the ketogenic diet on PKD. The idea, the research has shown that these diets can potentially attenuate cyst growth. Human data is emerging, and supposedly, from what I hear, is coming out later this year. But animal studies have shown that these diets are beneficial in this, and if this is indeed true, it could be a game changer in what has otherwise been a notoriously difficult disease to treat. But what I was saying earlier is that you may be able to derive the same benefit with just taking the supplement. So which is BHB, beta hydroxybutyrate, which is a ketone that is produced during the ketogenic diet. So you may be able to have your cake and eat it too, theoretically. Your strawberry shortcake that is made with whole grain flour, etc. But this there's a company coming out, and they're producing a proprietary formulation of this that combines citrate with it, and supposedly later in the year should be available for patients with PKD, and hopefully we'll have evidence at the same time to support it. But for those who really want to get a jump start, BHB is on Amazon, citrate's on Amazon. These are things that are widely available. I'm not recommending to do that. You should definitely discuss it with your doctor, since these are unproven therapies. But I just wanted to let people know as much as I know, so they can ask the right questions to the right people.
Excellent. Excellent. Dr. Blake, keto diet, good, bad, indifferent, what do you think?
Well, the high points are, as Dr. Joshi said, it's a moderate protein, high fat diet, and so it doesn't really cross that that bridge into really high protein diet. And the people on the internet will get you as soon as you make that statement. So that's really important to remember. And then we don't have a lot of data on the keto diet in the long run for people with kidney disease. The pediatrics have a tendency to have more kidney stones. The thing that I kind of, and if it turns out that the keto diet is great for people with PKD, then of course I'll be all for it. If that shows long-term health benefit, can delay the growth of cysts, keep people off dialysis, make their life longer. The difficult thing for keto diet is it kind of falls into one of these fad diets in a lot of ways. So when you see people come to the office who ask about the keto diet, it's often because they've either seen it online or their spouse or their aunt, their uncle lost 30 pounds in 6 weeks, 50 pounds on the keto diet, and they want to know if they can have that really quick weight loss, that works for a lot of people. But it's not a long-term solution for a lot of people. So maybe you can lose those 30 pounds in 6 weeks, but if I see somebody back in 2 to 3 years, I can't tell you, maybe 1 to 2 people who have gone on the keto diet can maintain that kind of health benefit and stay on the keto diet for a long period of time, because it can be a difficult diet to stay on. So, when I talk to people about health changes and ways to eat a healthier diet, I'm thinking something that can keep them going for 10, 20, 40, 50 years, not something that's going to help you lose, 30 pounds in 6 weeks. If we lose 30 pounds over 6 years, I am thrilled. Okay, so that's the way I look at it. We're still getting a lot of data about the keto diet and kidney disease, but it certainly is a difficult diet to maintain for the long term.
Okay, we'll start with Dr. Blake this time. Are there any differences among patients in terms of sex, age, or other natural differences for kidney patients that are on a plant-based diet?
I think everything is individualized. And so whether or not it's male, female, maybe a little bit of difference in protein requirements, age also maybe a little bit different protein requirements depending on what your activity level is. But the key for me is everybody has individual needs. Everybody has dietary preferences. Everybody has other health issues, whether it's diabetes or obesity or kidney stones or some other health problem that maybe makes their health needs, their protein needs, their dietary needs a little bit different. So really, to get into those specifics, everybody should have a dietitian as far as I'm concerned, because they can really help determine your exact needs, what your preferences are, what you can afford, what you like to cook, what you like to eat. And so I kind of leave it to the dietitian when we get into kind of real specifics like that.
Dr. Joshi, same question. Is there any major difference in a plant-based diet based on sex or age or other inherent characteristics?
Not as far as I know. For sex, really. I mean, if you're a male, you'll probably need more protein, especially if you're a bigger person versus a smaller person. For those who are older, there is some concern about the bioavailability of protein. Admittedly, that is something I should do a deep dive on, but I've heard this anecdotally. And I've heard that some people have been recommending a 10% extra additional amount of protein in the diet to take into account for those who are of older age. What is defined as older age is unclear, but to help avoid the risk of malnutrition or protein energy wasting.
Okay, let's talk about the future of plant-based kidney diets for kidney patients. We'll start with Dr. Joshi. What do you see in the future, Doc, as far as evidence-based plant-based diets are concerned?
Yeah, I think the future is going to be more observational studies because those are relatively easier to do. I think as more databases become available and more researchers take notice of this, I think we're going to get more research from observational studies in the same direction. But I think I can only hope that we have more randomized controlled trials, what Dr. Blake was alluding to. That would really be helpful in kind of giving us the confidence that this is helpful, this is safe, this is useful. Right now, some of the best randomized controlled trials are the work that's been done in regards to natural alkali by Don Wesson and Nimrit Garaya and their colleagues. But beyond that, we don't have too much. But what we need is the funding, the interest, and the prioritization by the NIH to do these types of trials.
Okay. Dr. Blake, what do you see as the future of plant-based diets?
Well, I think that if we ever can get those randomized controlled trials, they would be very helpful. But I think as a society in general, we're starting to see more and more of a understanding of plant-based diets and the benefits just in general, not only on somebody's health, but maybe on the environment and climate change of eating a plant-based diet. You know, when I started in South Carolina 12 years ago, I don't think any of my patients were on a plant-based diet. They probably would have laughed me out of the room if I would have even suggested it. But 12 years later, things are much different. It's much more prevalent. People are much more interested in trying it. And I think if we can kind of get more data along with the data on the absolute health benefits so we become more certain in that, combined with more interest from people, as well as more look towards a sustainable diet for the planet, that maybe we'll see a change and a dramatic increase in the amount of people who are interested in plant-based diets and how it impacts their kidneys.
Excellent. Question for Dr. Joshi. How do you feel about winning the NKF's Koppel Award, the youngest person ever to win the award? Congratulations.
Thank you. It's a huge honor. I'm very lucky to have won it. I definitely stand on the shoulder of giants. When I first got the email, I thought it was a scam because I didn't understand how I could have. You know, I constantly get emails from, you know, the prince of so and so that I've won $1 million, and you know, it's clearly a scam. And then I got this one. And I thought, well, this can't be possible. And I almost deleted it. And then I read it again. And then I think, you know, everything, the email looked right. And they had my name spelled correctly. And then it was from NKF. And then I was like, holy cow, this is really amazing. But it's really is a huge honor. I didn't even realize that I had done so much in such a short period of time to really gain that kind of notice or that kind of attention. But I'm still floored and in awe. It's like you know, I have to pinch myself from time to time.
Well, as a kidney patient who's lost 5 members of my family to PKD, I thank you for your hard work and your research. Much appreciated, my friend.
Oh, thank you. And I'm sorry to hear that. PKD is a devastating condition. It's unfortunate, and you know, it's unfortunate that we don't have really great treatment for it.
Mm-hmm. All right. COVID question. In light of the Delta variant and the recent remarks by the CDC, we'll start with Dr. Blake. What kind of advice are you giving your patients currently of how to avoid the COVID-19 Delta variant and the virus?
But well, I'm starting with the fact that you should get vaccinated. I've been telling all of my patients, you know, from the beginning that vaccines are the most effective treatment really that we have right now for avoiding COVID-19. And I've had a lot of resistance with that, you know, over the course of the last 6 months down here in South Carolina. But the most important thing is the vaccine. And if you have a kidney transplant or are on immunosuppression, there's information coming out that you may not have developed antibodies after 2 shots. And so you may talk to your nephrologist, and it may be something where we have recommendations for you to get a booster shot or a 3rd shot sometime in the next weeks to months as we learn more about it. And then, you know, we're also learning that this Delta variant is sometimes elusive of people who have either had COVID before or the vaccine. And so, you know, while we get through this difficult time where COVID, it really is, it's very prevalent, especially down here in the South now. I think we've gone from 200 cases maybe 3 weeks ago to 2,000. I mean, just exponential growth. Make sure you got that mask on again. If you can get hold of a KN95 or an N95 mask, just be careful for a short period of time here, and maybe we can get over this fourth hump. But still be very careful.
Okay, Dr. Joshi, your thoughts?
Yeah, I think the first step is getting the COVID-19 vaccine. I think we have to be clear and continue to reinforce the message, especially when there's so many opportunities for misinformation. I cannot state strongly enough to get the COVID vaccine as soon as possible. If you haven't, if you're one of those people that has only gotten 1 out of 2 doses, get your second dose. If you've got no doses, get it as soon as possible. What I'm curious about is that will we at some point in the future start recommending to our dialysis patients to get a booster? I think that's on the horizon, even though our patients on dialysis are not immunosuppressed in the traditional sense. They're not on chemo. They do have weakened immune systems, and they do have difficulty mounting immunity to other things like hepatitis B. They often need booster shots for that. So I'm keeping my ears peeled for that recommendation. And I think ultimately we may be moving towards where we all need a booster shot based on the recent Pfizer data, which showed a decrease in effectiveness from 96% to 83%. So I think that's probably on the horizon.
Yeah, I can see a booster shot in my future soon. I've had both Pfizer shots, and I was told I'm not exactly building a lot of antibodies. So either a third shot or a booster sometime for your Uncle Jim very soon.
Right.
All right. Last question. Is there anything tonight that you think is important that I failed to ask about, or that you would like to state for our audience? We'll start with Dr. Joshi.
I think I think what we didn't cover is that it's not so necessary to be totally plant-based to get the benefits, and this kind of ties in with what Dr. Blake was alluding to earlier. Is that it's difficult to make the transition completely, but it's also not necessary to make the complete transition to get most of the benefit. When you look at non-kidney disease patients, general population, and the benefit, somewhere between, there's no exact number, but when you ask experts in the field, they say anywhere between 80 and 90% is when you start to plateau. So if you're eating healthy 80% of the time, 90% of the time, the remaining 10%, the experts will argue about till the end of time, but you're getting the maximal or almost the maximal benefit that you can for your health. So when I use this when I talk to patients to kind of not overwhelm them, but to make substitutions, and sometimes the earliest substitutions, the low-hanging fruit, no pun intended, is what can really help people, cutting out the fast food, cutting out the pizza, the fried food, the sodas, and making some small changes can go a long way, and then you can build off of that.
Excellent. Dr. Blake, your thoughts?
I agree with everything that Dr. Joshi just said. All that stuff is very, very important. Small changes can go a long way, and cutting out that low-hanging fruit, like not stopping at the gas station for your breakfast or the Hardee's for your lunch, and really kind of learning to cook and paying attention to what you're eating can go a long way towards improving your health. And then, Uncle Jim, I didn't know if you wanted me to do a quick 3-minute recipe here before we go.
Yeah, please. I'm sorry, okay. Please.
All right, I just do a quick recipe here for everybody. This is a broccoli salad. So plant-based, we're going broccoli here. Let's see what we could do. Okay, great. So first thing we're going to do, traditional broccoli salad has a lot of bacon and cheddar cheese and mayonnaise. And so we're going to try to recreate some of those flavors without a lot of those ingredients, or less of those ingredients. So we're going to use a little bit of mayo here, just about 1/3 of a cup, going right in our bowl. You can use vegan mayo if you want to keep it totally plant-based. Instead of our bacon, we're going to use smoked paprika. Kind of gives a little bit of that smoked flavor and nice little spice. So just about 1/4 teaspoon. And then we've got apple cider vinegar. A really nice way to add some tartness to a dish without adding salt. Most people who have kidney disease need a low sodium diet. So vinegar and apple cider vinegar is a great way to start. We got 4 teaspoons of that. And then we've got just about 1 tablespoon of shredded Parmesan cheese. If you wanted to keep it totally vegan, you could use something like nutritional yeast, or just vegan cheese, or just leave the cheese out altogether. We're going to whisk that up. And then our last ingredients, we've got our broccoli. So I'm using raw broccoli, but raw broccoli is kind of a medium potassium vegetable. If you don't like raw broccoli, you can use steamed broccoli, or you can blanch it to kind of take the edge off a little bit. You put the broccoli in boiling water, let it boil for about 1 minute or 2, and then shock it in a bowl of ice cold water. That will take off a little bit of the crunch of the broccoli. I tend to like it crunchy. But then we're going to add some scallion, a couple green onions to kind of give the dish a little bit of bite. Some dried cranberries. Dr. Joshi mentioned dried fruit as a way to kind of get a lot of potassium sometimes. Dried cranberries are a lower potassium dried fruit, so you don't quite have that worry. And then we're going to add pepitas, or some pumpkin seeds. Give you a little bit of plant-based protein, some magnesium, kind of a really healthy, nice salad to take the place of your traditional unhealthy broccoli salad. Give it a little stir. This recipe is in my book if you're interested, along with others. My book is not fully plant-based, but we do have a lot of plant-based dishes, and just a really nice, quick broccoli salad with some crunch, some sweetness, some tartness. So try it. Let me know what you think.
Great. I just wanted to say, Doc, that in the original post of this broadcast, I posted links so people can buy your book. I posted links so people can find the website. And I also posted a link so people can subscribe to your newsletter, which comes out every month or so. And I always share those recipes. I got 3 or 4 recipe groups that I manage out of the 84, 85 groups that I manage on Facebook. So I want to make sure that everybody gets a chance to read all your new stuff and get to know you as a great dietitian and a great kidney doctor.
Thank you.
All right, guys, I appreciate you taking time to speak with us tonight. I learned so much. Thank you.
Thanks
you guys have a good evening.
Thank you. You too.
Thank you.
All right, and for the rest of our audience, next week, August 6th, Shane Blanchard's on with us. He's going to bring on his donor. We're going to talk about his first transplant. He's working on getting a second transplant, how his donor got hooked up with him, his current feelings about Shane's kidney being rejected. So a lot of interesting things going on August the 6th. You don't want to miss that. All right, Steve, the show is over. I'll talk to everybody later. Bye-bye.
know that they ride or die. I keep boys by my side, CJ Ike, now I gotta roll with ice. Cold, these brothers my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta roll with ice. Ride or die, 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 ride or die. Cold, these brothers my guys, know that they fly, know that they ride or die. I keep boys by my side, CJ Ike, now I gotta ride or die.